Some are calling it a growing national crisis, the shortage of school nurses. Only 3 out of 5 schools across the country have full-time school nurses. Hillary Lane reports for WJZ this often forces school administrators with no medical training to step in and provide some level of care.
Did the school district fail your child?
And they failed them always. Right? They weren't there to help him.
Last October, Rasheen Presley's 9-year-old son, Hassan, collapsed in the school cafeteria. He was rushed to the hospital where he was later pronounced dead of heart failure.
That was my only son. I want nobody there to help me. Nothing.
There was no school nurse on duty that day. According to a Philadelphia school district official, staff certified in CPR tried to revive Hassan, who'd been born with a heart defect. It's unknown had a school nurse been there that day if they would have been able to save Rasheen's son.
Did Miss Millie talk to you before?
There are no federal laws regulating school nurse staffing, but the American Academy of Pediatrics recommends at least 1 registered nurse in every school, a standard many districts are failing to meet.
That is a crisis.
Donna Mazik, the executive director of the National Association of School Nurses, says 40% of schools across the country don't have a full-time nurse, and 25% don't have a nurse at all.
It's not acceptable. Students deserve what they need in order to be in school and ready to learn.
So now time for school number 2.
Yes, we'll go to Bushy Park, my elementary school.
Deanie Gorby-Crease is a school nurse in Howard County, Maryland, who covers 2 schools a day. She has health assistants at each school who call her with questions when she's not in the building.
If I'm busy with an emergency at my other school, I'm not available right away, so it might delay their care some.
Look at my nose.
In Cincinnati, Ohio, where nurses were also sometimes covering more than 1 school, they're tackling the problem through a partnership with Cincinnati Children's Hospital.
We now are able to provide routine primary care services for all of the students in the building as well as any child in the community.
They've opened health centers in schools to close the gap.
So students get services here no different than they do in a pediatrician's office.
In the wake of his son's death, Rasheen Presley says schools must find a way to provide care for all students.
If you ain't got no nurses at the school, you might as well teach your kids at home. That's just common sense.
Hillary Lane, CBS News.